So the goals of harm reduction are to improve health and well-being of individuals who use drugs, their partners, families, associates, and communities. Once again, law enforcement, school playgrounds, public playgrounds, the streets, families. Harm reduction saves lives and improves public health. And the goals of harm reduction is to highlight and address the roles of discrimination due to poverty, racism, and sexism, homophobia, social isolation, trauma, and other health inequities in drug-related harm. The roles of dignity, respect, and empowerment in reducing harm. You know, we didn't assign any disrespect. We didn't try to take away anybody's dignity when we, as a society, implemented the seatbelt law or the bike helmet law. It saves lives. And the theory, or sort of the mantra in the harm reduction model and the harm reduction world is, you can't help a dead person. So harm reduction keeps people alive until there are resources available, until the time is right, until we can get to them to try to see if they would participate in any help. Right? In the meantime, how do we keep folks alive? Here's some goals of harm reduction relative to disease prevention. So at the end of 2018, this is from the CDC, Center for Disease Control, an estimated 1.2 million people had HIV, and of those, 186,000 were among people with HIV attributed to injection drug use. So I'm not sure about the math, but that's probably somewhere around 15% of people with HIV and were attributed to HIV. And this injection drug use, but this is only relative to those that were tested and found to diagnosed with HIV. We are not tapping into, obviously, the people who have HIV as a result of injection drug use and have not yet been tested. Some selected characteristics of those with people with injection drug use, that's what PWID stands for, in 23 cities in the United States, reported being homeless, 64%. And I can share with you at many of the outreach syringe exchange programs, many of the individuals that are reporting or presenting at the syringe exchange are homeless people. And if we can help decrease the spread of HIV with among the homeless population, it's hard to recognize, folks, but that will impact our hospitals. It will help alleviate some of the stress from our nurses and doctors, and stop taxiing the whole system. 31% reported being incarcerated, and 21% reported having no health insurance. So, you know, it can be any number of reasons why a person contracts HIV. And it's really important to be able to meet people where they're at with prevention strategies. So we want to, as a society, understand about this 21% who contracted HIV with no health insurance, and 31% that are incarcerated, right? How are these folks becoming infected with HIV in these situations? And what can we do to prevent it? Goals of harm reduction: people who inject drugs and hepatitis B and C. This is a quote from the CDC. Both hepatitis B and hepatitis C are blood-borne diseases. People who inject drugs are at risk for hepatitis B and hepatitis C infection through the sharing of needles and any of the equipment used to prepare and inject drugs. So it's not just the needle, but it's the cotton, it's the cooker, it's the water. So HIV can live and Hep C can live in those environments from 2 weeks to 60 days. So just because somebody has cleaned one of their needles, or maybe they cleaned their cooker or their spoon, it doesn't necessarily mean that the disease itself has been cleaned off from all the equipment. Hence the need for clean needle syringe exchanges. In recent years, an emerging HCV epidemic has been occurring among young people with injection drug use, particularly in rural and suburban settings, underscoring the need for routine hepatitis C for people who continue to engage in high-risk behaviors. Hepatitis C is 10 times more infectious than HIV. Moreover, contaminated needles and syringes are not the only vehicle for blood-borne HCV transmission. This virus remains infective in liquid syringes and on inanimate surfaces for weeks. So, even in blood spills or bodily fluid spills, Hep C and HIV, I like this term here, injection, no, that's not the term I like, infective, remains infective, like I said, from anywhere from 2 weeks to 60 days, depending on the virus and the quantity. So that's something to think about. There is also an explosion of soft tissue infections and endocarditis, which is also taxing hospitals, staffs, and costing millions and millions of dollars to our economy. So clean syringes can help prevent endocarditis, can help prevent soft tissue infections. Okay, and think of it as the ripple effect or the domino effect. If we can prevent the spread of disease, we can prevent compassion fatigue and burnout from medical providers. We can prevent high turnover ratios and high costs. So this is very beneficial for all involved. I hope that you're starting to see some of the benefits to this harm reduction model and opening your mind to the concept of what does this harm reduction model actually mean. So let's look at harm reduction strategies. Harm reduction aims at reducing mortality with the following strategies. And we'll cover a couple of these more in depth. And the other ones, once again, you can do some continued research with harm reduction agencies in your area. So access to free naloxone, evidence-based treatment options. Housing first models is actually something that was developed in Canada, and it promotes the concept that if we can provide more housing for individuals who struggle with safe and secure housing, that we are setting them up to achieve drug use goals more, I don't want to say easily, but they will be more capable of reaching their drug use goals. So criminal justice reform is harm reduction strategies, right? It's taking a look maybe at some moderation-based strategies, or instead of insisting someone goes to treatment and to AA or NA, providing them with some options that they choose what might work for them and would be willing to do rather than mandated to do. Drug policy reform, again, a very large national advocacy movement with a lot of legislation happening right now. Healthcare coverage, improved healthcare coverage for folks. The syringe service program, we're going to take a little bit closer look at that. On-site drug checking, we'll take a little closer look at that. Safe supplies. There are some areas that are looking at offering the sale of what is considered illegal drugs selling them in a safe and protected environment, so that we can be sure that the drugs people are purchasing are safe to use. And very, very layered, textured legislation and advocacy work going on in that area right now. Certainly nothing that we will see in the immediate future in 2021. Supervised use, so safe use sites. These have been known to work in Canada and in some European countries. I don't actually know if there are any in the US today. I will check into that and get that to you in our next section. So let's go ahead and move forward. So here you see an overdose prevention site. This is a safe use site down here on the left-hand side. And this over here on the right-hand side is another example of some progress and some advocacy, grassroots warriors making a difference in the lives of people who use drugs. And what this website does is you can call up and you can let this website, the individual on the other end of the phone, know where you're located. I think they ask you what your first name is and your phone number, and you're going to tell them what you're going to use, and then you will disconnect. You will continue with your drug use, and they will call you back in 10 minutes. And if you do not answer your phone, they will call 911 and send out first responders to check on you. So, again, very innovative, saving lives. And I actually have some statistics on the lives that this program has saved. Some other harm reduction strategies. That word is tripping me up today. Okay, so reduce mortality with access to free naloxone. This has been a very nationwide effort to provide free naloxone to individuals, and this can be accessed through any number of portals depending on the state. Some of them can be, you can receive it at fire station, some at police, some states offer it at the police station, some states are offering it through the hospitals, some states are offering it through the community recovery organizations or other innovative programs that connect with people that are connecting with people who use drugs and that are centrally located. So folks do not have to really go out of their way to get access to the free naloxone. Some states, you can find out where to access free naloxone through calling 211. And every state has a 211. For many of you, you might remember using 411 as a directory information to get a phone number. Well, the 211 is very similar like that. It's a resource outlet, and you can call your states every state has a 211, and you can call your state's 211 and you can get help with your taxes. You can get help with removing shopping carriages in your driveway. You can get help with first and last month's rent if you're financially strapped and need assistance to get into housing. You can call 211 to get access to treatment, access to naloxone, access to family resource centers. I mean, 211 is such a beautiful portal. I think one of the most unique uses of 211 that I have heard of was when somebody needed some funding for a service dog, and they didn't have all the money to get the service dog, so they called 211 and 211 in their state, and 211 was able to connect them with a program that provided assistance in getting service dogs. So there you go on 211, a little detour with some valuable information. So naloxone distribution grants, grantees report having distributed 645,000 naloxone kits, and the grantees of this, when they say grantees here, these are grantees that have received funding from the federal state opioid response program. So these grantees, these programs were established where organizations could hand out free naloxone as part of the state opioid response grants from the federal funding. and they're reporting 32,300 opioid overdoses were reversed. So that's 32,300 people that did not die as a result of this program. And it was difficult for me to sort out what dates this was, because if you go to this link, you'll see that this report indicates that it's actually reporting on 2018 and 2019. And I couldn't decipher if these numbers were from 18, 19, or both. In any event, it's a significant amount of numbers that folks' lives were saved. And if we look at the fatal overdoses today, as of this recording, we have just received news that in 2019 to 20, I believe, or 20 to 21, I think it was May 20 to May 21, there were, for the first time in history, over 100,000 fatal overdoses. So this 32,000 has prevented 1/3 of those overdoses. So this program works. This is an effective harm reduction strategy. Another harm reduction strategy is fentanyl testing strips. And they look just like you see it here in the image. And what individuals will do is they'll put the strip in their cooker and they'll test the drugs to see if there's fentanyl in there. And, you know, if folks weren't intending on taking fentanyl, and we know that fentanyl is really what's causing the majority of these overdoses, then they can use different strategies that might sound quite disturbing to you, but they might use less. They might still use it, but they might use less. When they use less, they're saving their own life. First-hand accounts with young adults who use drugs find rapid-acting fentanyl test strips are an effective tool to reduce overdose risk. Okay, once again, we're trying to save lives and reduce the risk associated with drug use.
Hey there, this is Ginger. I hope you're learning a lot from this series. I'm asking for your help in supporting my tireless efforts. There's a few ways in which you can support me. Tell your friends about this video series, subscribe and like each video here on YouTube down below, make a donation on my website, or invite me to deliver this training in person. Together, we can all be part of the solution. Hope to see you soon, and thank you.